Hi, I'm Janelle Marie. Welcome to Body Beautiful, the show where we talk with local professionals about the latest in cosmetic procedures and medical devices. With us today, we have plastic surgeon Dr. Joseph Mele. We're talking about a couple different procedures today. Let me see if I can do this. Facial augmentation, augmentation mastopexy. We're going to find out what that is. And then we're also going to talk about mini tummy tucks and gynecomastia. We have so much to talk about.
You got them all.
I got them all. But, you know, before we get started, any advice we give you, consult your own physician. Let's jump right in. Welcome back, Dr. Mele.
Thank you. Nice to be here.
I know. It's so glad to have you back. But first, let's talk about facial augmentation.
Okay.
What is that, first of all?
Well, augmentation means enlargement.
Okay.
We have breast augmentation. We also do facial augmentation.
Okay.
The areas most commonly where we do facial augmentation are chins, cheeks, and noses.
Okay, so augmentation, does that mean you put something in, or does that mean you can do fillers? What can you do?
Either way.
Okay.
But more specifically, the more permanent results are found with implants.
With implants?
So we have implants that fit the contour of the cheek. They come in all different shapes and sizes. We have implants for chins.
I know.
Even square implants.
What are
Implants
those
with
for?
dimples.
Oh, really? You
all
can do
different
dimples?
sorts of implants. Most people just want to augment what's the shape that's already there.
So then who's the best candidate for this? Because how do you know that
Sure.
you need facial augmentation? Seriously. I mean, you
some
know
of-
you need fillers.
Sure.
But what about the actual
Well, fillers were
augmentation?
usually filling in wrinkles.
Right.
But sometimes I'll use fillers in the cheek area to enlarge the cheek.
Okay.
Just to provide balance and harmony to the face.
Okay.
So a lot of it is math.
Yeah.
You wouldn't think math has
No,
a lot
you
to do
wouldn't
with
think
beauty.
math.
But a lot of it has to do with ratios of one part of the body to another.
Okay.
So if there are people who naturally have a cheek that is behind their eye. If you look from the side. It doesn't look odd. Many people have it. But when we bring it forward, it tends to look better.
And so what's involved in doing facial augmentation? Like, what do you know, how do you put things in? How do you do that on the face? Because that's delicate.
It is delicate, and that's why we are very sneaky when we try and do
I
these
like
sort of
that.
things. For the cheeks, there's several different ways that we approach it.
Okay.
If I have someone who we're doing a lower eyelid, sometimes it's advantageous to augment the cheek to give the eyelid some more support. I can put the implant in through that same incision, through a lower eyelid incision. If we're not doing other surgery, oftentimes I'll put them in through the mouth. So the scar is completely hidden.
Wow.
And if we're doing facelifts, we can put them in through facelift incisions. And for facelifts, it's very helpful because part of the aging process is we lose some of the stuffing, the fat on the face. And by replacing that, it can actually help.
And so then, do you know that they need a chin implant, or is that a different kind of patient that would need a chin implant, or does that all go with the whole augmentation process? Do you have to do everything?
No.
Or, oh, okay.
No, normally we're doing one, and most of the time we're not doing any of these. These are not the most common operations that we do,
Yeah.
but they can be complementary to the procedures that people come in for, or sometimes that's the primary reason someone will come in. If someone has a very small chin, it kind of gives a weaker appearance to the face. For men, that's a bigger problem than for women, but I do chin augmentation for both. It also interplays with the nose. So if the chin is farther back, it enhances the size of the nose, it makes the nose look bigger. And about once a year, I'll have someone come in for rhinoplasty who has a well-proportioned nose, but their chin is far back. And we add the volume to the chin. And we can do it on the computer to simulate it, and their nose magically looks smaller because the reference point has changed.
Let's take a look at some before and afters. Let's look at the first one.
So this is someone, an Asian patient who comes in with a small top of the nose, so the area between the eyes is back.
Okay.
So what I've done is I've put an implant in there to increase that
yeah, I
space.
can see that. So you put an implant on the top of the nose.
So the implant goes right on the dorsum, right on the top of the nose. Some of them are just in that area. Some of them go out to the tip. Her tip was fine, did not need any augmentation there. So this is just a segmental nasal dorsal augmentation.
Recovery for something like that?
Pretty quick. It can cause bruising, just like rhinoplasty can cause a little bruising at the eyes. Usually bruising is lessened with rhinoplasty. Within a week or so, they're back doing what they want to do.
Let's take a look at number 2.
So this is a chin augmentation.
Oh, yeah, look at that.
I should make you guess. What did I do?
Yeah, I know, please.
Sometimes, unless you know where to look,
Where's
it's hard to
Waldo?
tell. It just looks
That looks really good, though.
Fine.
Look at that. That's
And
a huge difference with
we
just
can
a
see
small...
beforehand her chin is behind the lips. Afterwards, it's even with the lips, and that's kind of our reference point. That's kind of where we want it to be.
And so she didn't need any cheek augmentation on that one? Was it just the chin?
Just the chin.
Yeah, man, that's
it makes a big difference because the chin and the forehead are two areas that we really evaluate the profile.
Oh, okay. All right, that's neat. Now, recovery for chin implant as opposed to your, the nose implant?
Again, a couple weeks.
Okay, so not a
depends
big
on the
deal.
type of implant. There are silicone implants which tend to heal a little bit faster. There are also med-pore implants, which are a synthetic plastic that is much harder than silicone. And it has holes in it so the body can grow into it and keep it in place.
What about this picture?
So here we've done a cheek augmentation.
Oh, yeah.
So
look
on
at
the
that.
left, you
Wow.
can kind of see there's an additional shadow between the eyelid
Yeah.
and the nasolabial folds, the smile lines. Afterwards, those moved out. Also, the lower eyelid looks shorter.
Yeah.
And we've
That's
just decreased that distance by
And
adding
look at-
volume to the
no
cheek.
wrinkles. The wrinkles are gone.
Yeah, I
so
think
so
it-
you put an implant in that
So I
cheek.
put an implant in to fill that cheek. I also have done a facelift in this patient, so that
Oh,
also
okay.
helps with the wrinkles.
Okay, cool.
But the contour is all from the implant.
And I like that because it's not, you know, to the point of where you can actually see that she's had a cheek implant.
No,
I mean,
it's
sticking out, kind of
Normally,
sharp.
we're not trying to over-augment it.
Okay.
Usually people aren't trying to make a statement with their cheek implants.
Right, exactly.
But we
Very
just want it
subtle.
to match the rest of the face.
Fantastic.
So usually we're replacing a hypomalar or a small
Yeah.
cheek.
Excellent. All right, for more information about Dr. Mele, you can call 925-943-6353 or check him out on the web at either drmele.com or sanfranciscobreast.com. We got lots more to talk about here on Body Beautiful. We're going to come back with lots more procedures, so you stay right there on Body Beautiful. Dr. Mele and I will be right back.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.